Hi, I'm Charlene, and today I'll be introducing our app called Elucidin. Elucidin is an AI-powered medical translation application designed to minimize communication barriers between patients and healthcare professionals. By combining intelligent translation, accessibility features, and healthcare support tools, Elucidin enables patients of all languages and dialects to communicate competently and understand their medical care. So, what's the problem that we are solving? 6 things stand out. Limited access to interpreters, language and dialect barriers, complicated medical terminology, poor internet connectivity when using translation apps such as Google Translate, and ultimately, medical errors and hinder quality of care. Statistics show that the language barriers severely impact patient-provider communication, satisfaction, and healthcare outcomes. The language barriers in healthcare lead to miscommunication between medical professionals and patient, reducing both party satisfactions and decreasing the quality of healthcare delivery. Interpreter services actually contribute indirectly to increased costs and extended length of treatment visits. One study reported that the implementation of online translation tools such as Google Translate and MediBubble in hospitals, which increased the satisfaction of both medical providers and patients up to 92% and improved the quality of care and safety. This is a real issue that we want to address, hence we aim to reduce language barriers for not just the patients, but for healthcare providers as well, to reduce miscommunications and provide better quality of care in the healthcare sector. Therefore, this leads me to our opportunity statement, which is how might we improve the digital experience for patients by removing language barriers to make it inclusive and accessible for everybody, regardless of language, experiences, and background, to reduce medical errors due to miscommunications between patients and healthcare professionals.
Asha, and I'll be presenting about this part. So we have compared to other AI medical translation apps, such as, for a really good example, Care to Translate, which is a very authentic app that a lot of medical healthcare sectors use. So the features that Care to Translate include, and these are all from their websites, we have medical phrase library and live translation, dictation and image support, their translation history, offline mode interpreter services, languages, and verified translation match and reverse translation. And so what we have tried to implement is that in our AI medical translation app Elucidin, we provide live translation, dual language, 90 plus languages, dialects, emergency modes, appointment bookings, histories, introduction page. As our specific introduction page has no default language setting for a patient, which is a special feature for later on, and medical terminology library, speech text handwriting feature, adjustable font, offline translation, and simple navigation to the app. So we have some unique application features in Elucidin, 4 which are your introduction page, which I said earlier, family mode, memory mode, emergency mode, your medical history, and booking appointments feature. So this is our first prototype, which is our introduction app page. So how this works is that we speak into the app and the AI will pick out the language for the patient and match it to the language that they speak. And the second option is to choose the language manually. So this is something that we want to accommodate to a lot of patients. And so for family mode, we have addition and removal of family members, name, relation, phone numbers. We toggle emergency contact status, one-tap alert button, and after-hours update for explanation. Memory mode, which visit history and expandable summaries from doctors, the date of it, the full description. Each visit lists medications, dosage. Next appointment has a reminder, and share summary for family button. So all of these accommodate into the app. And other parts are like your medical history, which is includes blood type, conditions, allergies, drug allergies, surgeries, family histories, vaccination records, and overdue upcoming. You have your appointments booking, which is popular within our testers later on, which nearby clinics with star ratings, distance, traffic indicators, and wait time estimates, and booking, which is smooth process. And lastly, our emergency mode, which is a quick tap situation button for chest pain, seizures, stroke, and 4 emergency buttons.
Moving on to our potential feasibility analysis, we identified 3 key challenges and developed concrete strategies to address them. Firstly, regarding cost limitations, developing physical interpreter hardware is expensive. By building Elucidin as a digital software application, we significantly reduce overhead, allowing us to test locally before launching globally. Secondly, regarding technical risks, handling patient records requires strict PDPA compliance. We ensure complete data security through end-to-end encryption and regular security checks with IT partners. Thirdly, regarding competitors, we commit to continuously innovate and regular updates based on market trends. It's like Elucidin streamlines clinical interactions across the board. Most importantly, it reduces medical errors like incorrect treatments or medication dosages caused by language miscommunication. The app is designed to be accessible for everyone, serving both healthcare providers and patients alike. From the interface, users can easily trigger emergency calls or book appointments, while family members can view the patient's current health status in real time. We also break down complex medical terms into simplified language so everything is clear. Overall, this delivers a seamless, reassuring experience for both patients and medical staff. Brings direct practical value to our daily lives by minimizing miscommunication between patients, healthcare workers, and caregivers. Our digital translation app eliminates the need to rely on physical interpreters to make it more accessible to everyone and reduce the need of physical interpreters. Furthermore, this drives higher overall satisfaction while elevating patient safety and care quality. On top of that, integrated tools like our quick booking and appointment features add everyday convenience for all our users. Looking at our user testing results on screen, the feedback from our 5 testers was largely positive. They praised the overall purpose of LC9, specifically highlighting the booking feature, family mode, and memory mode as essential tools for managing care and accessing forgotten information. Technically, testers were impressed by the speed of the AI language detection and the reliability of our offline translation mode. However, as shown under the negative feedback, we identified a few areas for improvement. Our medical terminology bank is currently limited, and we noted some UI glitches, particularly on the immunization records page. Testers also pointed out that AI accuracy can vary with uncommon dialects and that elderly users will require extra guidance to navigate the interface. Based on this analysis, our next steps are clear. We are expanding our medical terminology dictionary, resolving all technical glitches, and adding repeated appointment notifications for better family coordination. To ensure total safety, critical data will still be verified by healthcare professionals. Finally, we are balancing privacy features like screenshot disabling with easy family sharing while also creating guided tutorials to make the app fully accessible for our elderly users.
Based on that feedback, we've added several new features, enhanced privacy and security, a referral system for family services, and refinements to emergency mode. We've also introduced a new dark and light mode, as well as a dedicated doctor mode. Previously, emergency mode lets users describe a situation by text and flag if it's life-threatening, but had no location detection or local emergency numbers. Now, it automatically detects the user's country via location services with permission and falls back to manual selection if needed, so that users can always reach the right local emergency contacts. The old settings covered basic language, font size, and offline mode, but had limited accessibility and no privacy controls. The new version adds guided mode with bigger buttons for elderly or first-time users, screenshot protection that blocks screen capture of sensitive medical information, for our doctor mode, we actually, for the old version, had basic keyboard search with simple results, with limited information displayed, no options to clarify or refine, and no doctor-specific guidance, limited user guidance for understanding medical terms. But now with the newer version, the users have multiple input methods such as text, speech, handwriting, doctor mode for clearer and simplified explanations, sample phrases for quick use and guidance, and users can also choose the different language styles such as Singlish, simple, or child-friendly.
Okay, hi. So we're doing the evidence of our testing. Okay, so we actually tested on 5 people, but here are the 2 clips that we tested on. They are playing right now. So our first tester is trying our prototype. So we gathered their feedback, and here's the screen of what they are testing in our product. You can see how our app works. They are trying to book our app. They're trying to play around. So I'll move on to our analysis on our testing. So what's popular and what users love? So we have memory mode, appointment booking feature, family mode, and purpose of the app. And negative feedback, what we got is that AI is not accurate, the medical terminologies are limited, there are glitches in some parts of the app, and they need to have each country's emergency number and to be able to detect which country they're in. And based on the feedback, we can improve on having more tutorials to guide elderly patients, increase medical terminology, healthcare professionals should still verify important information, privacy features like disabling screenshots, and fix small glitches in the app. Okay. So we'll be talking about the new app version. Okay, so this is what we've done for the new app version. This is the concept representation. Most of these are new features or improved from previous feedback. So we have referrals for family services, guided elderly features with additional settings, emergency mode, and a dedicated doctor mode. So over here, to put it in depth, our menu display, the moment you get into the app, is that we have updated our menu display for family mode, extra access features, referrals, emergency mode, and updated additional features for memory mode, medical history. So all of these will have fewer glitches, and vaccination and lab results are in depth, and we have expanded the medical terminology bank, as you can see in the photos provided. And settings include the dark mode, guided mode, biometrics feature, and screenshot protection. So over here, one of our popular features that we want to showcase for our prototype representation. So over here, for appointment and bookings feature, you can see that this is your, for the first slide, this is what you see when you click into the prototype. So in the clinic nearby, you see the available timings. So you see live traffic, distance to the nearest clinic, and the appointment and bookings timing available. So when you click in the timing that you want, you easily be booked into the slot. And so it's a smooth and easy booking that most of our testers have tried out. In our settings, and for more in that, we have screenshot protection, which is a new feature to provide patient privacy. And biometric lock for Face ID or fingerprint is an added feature for personalized patient use. All of these additional features are all from our feedback. So here we're trying to accommodate, make it more accessible and personalized for most of our users. Guided mode is a new feature for elderly and first time, as we try to be inclusive and accommodate to our new users. And over here is you can download offline languages, better for smoother offline use, which is also one of our feedback. Okay. So overall, in summary, we have menu display features. So all of these is like a summary of our new app after the feedback that we had. So menu display, memory, family, emergency, doctor modes, referrals, medical terminology, and in our settings we have a guided mode, offline mode, screenshot protection, biometrics, offline downloading, And our improved features from the first prototype to the second, you can see that we improve features in appointment booking features, our emergency mode, our family mode, medical terminology bank, and AI accuracy. Thank you.